1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Hello, my name is Zen. I'll be your student for today. Could I please see your wristband? Could you give me a thumbs up if your name is Mary Smith? Could you give me a thumbs up if your birthday is 1/1/1970? Okay, perfect. So Ms. Smith, I can see that it might be difficult for you to talk. Could you please give me a thumbs up for yes, thumbs down for no to answer my questions? Thumbs up? Okay, perfect. So Ms. Smith, before I do anything else, do you have any allergies that I need to know of? No allergies? Okay, perfect. So Ms. Smith, what I'm here for today is I'm going to be doing some tracheostomy care. Essentially, I'm going to be suctioning your trach to get rid of any or get rid of some fluid, mucus, so that you can breathe a lot better. And then afterwards, I will be changing up the inner cannula for a new one, cleaning the site, and then replacing the gauze as well, just to tidy you up, okay? So this procedure should not be painful. If you do feel any pain, please raise one of your arms so I will stop what I'm doing, but it will be a little uncomfortable because as I'm going in and out of your trach, it may cause you to cough. Is that okay? Any questions or concerns? None? Okay, perfect. Okay, Ms. Smith, so I'm just gonna go ahead and raise your bed up. Hi, okay, and then close the curtain. Okay, you're at high follows, which is what I want to see. I'm gonna go ahead and listen to your lungs, okay, Ms. Smith? Give me a deep breath. Give another deep breath. Deep breath. Deep breath. Deep breath. Last one. Okay, I do hear a little bit of fluid in your lungs. I can see that your O2 is a little bit low. It's at 92%. And I can see that your breathing is a little bit labored. Does it feel kind of labored, Ms. Smith? It does? Okay. I can see that your respiratory rate, however, is within the normal range. It is 20 breaths per minute. So, Ms. Smith, I'm just going to make sure that I have all of my supplies here, so I can see that I have 2 trachs, one that is your size 8 and one size smaller, an extra inner cannula. I can see that the ambu bag here is connected to 15 liters of O2, which is exactly what I want to see, which is 100%. I can see that I have one suction canister here and one suction catheter, which is everything I want to see. Perfect. I'm going to go ahead and continue, okay, Ms. Smith? So hand hygiene for 20 seconds. Okay, Ms. Smith, I'm going to go ahead and clean my surface area, okay? Chlorine wipe. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 2, 3, 4, 25, 26, 7, 28, 29, 30. Across the edges as well. By the way, so now I will let the surface dry for 2 minutes. 2 minutes has passed. Okay. Hand hygiene for 20 seconds. Go grab my supplies here, Ms. Smith. Okay, one sterile saline, one used suction catheter, new trach stabilizer for you, one brand new inner cannula for you as well, and my treat kit. Okay, Ms. Smith, so I'm gonna have to replace this suction catheter because that was from last shift, and I don't know how long it's been there, so hand hygiene for 20 seconds. Okay. Go ahead and remove this suction catheter, throw it away. There's a new one, touch it. And go ahead and turn this on to 120 millimeters mercury. I can see that it's on, that is up, which is perfect, so it's working. And I'm just going to make sure that your oxygen is still working. It's at 15 liters, 100% O2, and it is connected to your ambu bag, which is everything that I want to see. Okay, Ms. Smith. just going to be preparing everything else, okay? Open our self-sealing, half into my disposable container, half into my trach kit. Okay, everything that I need. Hand hygiene for 20 seconds. Okay, Ms. Smith, now I'm going to go ahead and hyperoxygenate you because your O2 is a little bit low. I'm going to give you some breaths with the MD bag, okay? Hand hygiene for 20 seconds. Okay, Ms. Smith, I'm going to go ahead and remove your O2, okay? Okay, Ms. Smith, 6 seconds apart, okay? So, first breath, 3, 2, 1, 2, 3, 4, 5, 6, one more. I can see your O2 went up to 98%, which is exactly what I want to see. Okay, Ms. Smith, I'm going to go ahead and suction your trach now, okay? Just going to make sure that this works. So, go ahead and, I can see it went down to 100 millimeters of mercury, which is still within the range that I want to see. Okay, Ms. Smith, you ready? 3, 2, 1. Okay, 1, 2, 3, 4, 5. Did that feel okay? Did that hurt at all? No? Okay, do you want me to do that again? No? Okay, I can see that your O2 is still up at 90%, so I'm going to go ahead and give you your mask back, or your oxygen back, sorry. Okay, there we go. And if you did need another pass-through, I would wait 30 seconds, and I would also hyperoxygenate you again if your O2 did drop, okay? But you're doing really good so far, okay, Ms. Smith? Okay, hand hygiene for 20 seconds. I'm going to go ahead and start preparing to replace your intracranial, okay? So, hand hygiene for 20 seconds. Okay. Oops. Okay, Ms. Smith, I'm going to go ahead and remove your oxygen again, okay? Here's this. Okay, Ms. Smith, I'm going to take it off now, okay? Doing okay so far, Ms. Smith? Perfect. Ready? Wonderful, okay. How'd that feel so far? Are you doing okay? Good? Okay, perfect. I'm gonna go ahead and remove this now, okay, Ms. Smith? Okay, put it away. I can see that the skin looks clear and dry. I don't see any signs of redness, swelling, no signs of infection, no signs of pressure sores, okay? So that's looking really good. I'm gonna go ahead and start cleaning, okay, Ms. Smith? I can see your O2 still up, so I need to give you oxygen. So dip. Walk one direction. Dip in my sleeve. Begin at the top. Have some clogs here. Dip. Up underneath. Boom. So go up again, okay, Ms. Smith? So right at the top there. I'm just gonna clean your faceplate, okay? Okay. How's that so far, Miss Smith? Do you feel okay? You do? Okay, perfect. Just gonna pat you dry now, okay? You're doing really well so far, Miss Smith, okay? Almost done. So give you your split gauze back, okay? Or unused split gauze, I meant, sorry. There you go. Oh. Perfect. Okay, Miss Smith, how is that? Do you feel okay? Yeah, I'm gonna give your oxygen back, okay? Okay, perfect, Miss Smith. So now I'm gonna go ahead and grab another nurse to come help me. So I will be right back, okay? And hygiene for 20 seconds. I'll be right back, okay, Miss Smith? Well, Miss Smith, and hygiene for 20 seconds. I am back. I am here with Nurse Annabelle. She's going to help me with putting on your trach stabilizer, okay, Miss Smith? Nurse Annabelle, if you could come here, please. Okay, so I'm just gonna need you to hold onto the faceplate while I go ahead and change it out, okay? So hand hygiene for 20 seconds. Please clean your hands and put on some gloves. Thank you. Okay. Okay, I'm gonna go ahead and grab the new trach stabilizer. Okay, could you come here and please help? Miss Smith, we're gonna take off your oxygen, okay? Just one last time. Go ahead and please stabilize that. Okay, I'm gonna tuck this behind your neck, okay, Miss Smith? There you go. Go and take this off. Okay, I can see that the site or the skin area is dry and intact. I don't see any signs of pressure sores, no signs of redness, swelling, or infection, which is perfect. I'm gonna go ahead and touch the new one now. Okay. Thank you, Nurse Annabelle. Okay, I'm gonna just look at the other side as well. Okay, Miss Smith, almost done. Okay. So again, the skin looks nice and dry. I don't see any signs of redness, infection, no pressure sores, no redness. That's exactly what I want to see. Almost done, Miss Smith. I know my hand's in your face. I'm sorry about that. Okay, there we go. Perfect. So I'm just gonna put 2 fingers in there to make sure that fits snugly. Wonderful. I'm gonna go ahead and grab old stabilizer. Throw that away. I'm gonna give your O2 back, okay, Miss Smith? How was that? Did that hurt at all? No? Okay. How was the process overall? Did that hurt at all? Was there any pain? Did you feel okay? Thumbs up? Okay, perfect. Okay, so that should be everything. Okay, Miss Smith, last thing I'm gonna do is I'm just gonna assess you one last time, okay? Take a listen to your lungs, okay, Miss Smith? Take a deep breath for me. Deep breath. Deep breath. Deep breath. One more deep breath. Last one. Okay, Miss Smith, so your lungs sound really good now. I don't hear any sounds, no fluid. It sounds pretty clear. I can also see that your O2 is back up to, it's still up at 90%, sorry. Your respiratory rate has dropped to 16, and I can see that your breathing has become unlabored. Does it feel easier to breathe? It does? Okay, perfect. I'm gonna go ahead and lower the bed now, okay? Does this feel comfortable? Okay, perfect. I'm gonna go ahead and give you this call light. Please press that if you need me for anything else. I'm gonna make sure. Okay, my suction catheter is still there and it's still available. So again, I'm gonna be leaving now, but if you need anything from me, please go ahead and press the button. Keep your guardrails up. Okay, perfect. Okay, Miss Smith, I'll be back later, but if you need anything, again, please press that call button, okay? Thank you. And let me clean up now, okay? Hand hygiene for 20 seconds. Okay, goodbye, Miss Smith. Okay, so for my documentation, I'm going to say that the trach was cleaned and cannula replaced at 6 p.m. March 25th. The patient tolerated the procedure well. The site was clean. There was no signs of infections, no redness or swelling around the trach or around the trach stabilizer. There was, or the skin appeared healthy, sorry, and the sputum was clear. It was thick and there was a medium amount. And the patient before the procedure had an O2 of 92%. After suctioning, it was up to 98%. The respiratory rate before the procedure was 18, and afterwards it decreased to 16. And the patient's lungs before, there was some crackles, but afterwards became clear bilaterally after the suctioning, and the breathing was unlabored afterwards as well. That should be the end of my documentation. Thank you.